Hello, my beautiful people. This is Dr. Adesonya Adewale again on this episode of Go Healthy, Save Lots of Money. Another very critical point, another very critical issue. Critical in the sense that it can be occasionally controversial. How are you supposed to have your baby? Are you supposed to have your baby like the Hebrew women, by force, by fire? In other words, it must come to the natural path. Are you supposed to have cesarean section? Is it just by decision or is it just by choice? How are you supposed to have a baby? Are you one of those that used to tell the doctor, I have my grandmother who had 9 babies, all of them, nobody is 9 for now. I know Mrs. Baby who had 6, none of them by cesarean section. I have, my mom told me about one woman who had 12. Ask yourself, what are the contributing factors to all these figures we have? The reason are those women who had no other means of having these children then, and they are only left with one option. So there are few of them that will be successful, like the figure we gave you in one of our videos. There are some that will get stuck and there will be no way out and they go with it. But definitely you will have a story to tell about the one that are surviving, the one that escaped. You don't have anything to say about those ones that have gone. We have the natural path, what we term spontaneous vaginal delivery, when labor starts by itself, progressively unaided, and leads to delivery of the baby without any assistance. Then you can have what is called assisted vaginal delivery. It can be assisted either with any form of induction or augmentation, like you don't fall in labor on time. So with some drugs, and because there is a time limit for the baby to stay inside the womb. So if you are exceeding that limit, we want you to have your baby alive. We don't want the baby to die or to have any issue. So we initiate the process of labor. Or you fall in labor by yourself and you're not doing well, we help you to do well so that you can still have your baby through the vagina. There are various forms of assistance. All these various options exist because of our ability to evaluate, to check and pick who needs what, which cannot be done when you are not checking. By cesarean section, we mean the delivery of the baby with an incision made on the wall of the woman's abdomen and through the womb to bring the baby out. The main aim is to achieve the delivery of a live, healthy baby and give it to a healthy mother. It's a lot simpler these days, a lot easier. You can even be singing, not dancing though. You can be singing. In other words, you'll be well alert while they are doing it. You hear the baby's cry. You can touch your baby. You can even hug while the surgery is ongoing. So there is no need to panic. There is no need to be afraid of cesarean section. But there is a need to be clear about the reason for the surgery and ask questions. When you get the clarity, don't panic and don't run away. Let me quickly state 1 or 2 reasons your doctor can tell you you need a cesarean section, even when you're feeling okay. When you think, why not? If not, I can do this, I can do this. There are various reasons the doctor can tell you you need a cesarean section. One of the reasons can be maternal health, a condition of the mother carrying the baby. It can either be pre-existing before the pregnancy or even happening during the pregnancy. Like the ones that are pre-existing include maybe heart issue, heart disease, high blood pressure before you got pregnant. It can get worsened during pregnancy. So much so that if it continues, it can affect the baby and the mother. They want to halt it so that the baby comes out and they take care of you. Baby is fine, mother is fine. It can be a problem that ensues while you are in the pregnancy, like infection either of the womb or the membrane covering the baby, or even preeclampsia, which is the version that comes with the pregnancy, high blood pressure with other complications that can be rapidly progressing. And if it's not halted, it can take the life of the baby and or the mother. At times, people come with different pelvic shape, or either because of previous history of accident or naturally the shape of the pelvis is not capacious. You want to do a cesarean section so that the baby can come out without any stress. That's for the mother. Even the baby coming can also determine how he or she wants to come out. In terms of size and position, if the baby decides to be very big, there is the maximum size above which it will be difficult for the baby to pass through the birth canal. And position, there we all know how the baby is supposed to come. With head down. Any position outside might be very difficult for the baby and the mother. So your doctor might suggest you or advise you on the need for cesarean section. And remember, the baby coming is a being, a living being. Just like a human being on the surface of the earth, doing labor, that's why it's called labor, doing exercise, you all have capacity beyond which you cannot go further, like you get tired. And remember, this baby is still very small. If the labor is too strenuous for the baby and the baby gets tired, the baby has a way of communicating with the expert. Once the baby starts getting tired, the expert takes it and they halt the pregnancy by doing a cesarean section. Because the natural birth has a time. It's not something that comes very fast. It takes a while. And the baby gets tired to the point that it can no longer cover the journey, the distance. You must halt the pregnancy by bringing the baby out when the baby is still alive. And well, there is a reason why your labor is also monitored, why they check the opening of the cervix. There is a rate expected that is safe for the baby and for the mother. So if it's not moving at that pace, they give you a little bit of chance. If it's not moving, before it starts affecting you and your baby or your baby, they halt the process so you bring the baby out through this section. So I don't think doctors will just want to section you if there is no need for it. So anytime they discuss cesarean section with you, don't panic. It's very simple, it's very easy. More so these days with a lot of advanced technology. And in most cases too, or in some cases, the placenta just decide to block where the baby's own pass through. That's placenta previa. That one, there is no question about it. The baby's coming out through cesarean section. And the placenta that is staying where it's supposed to be can decide to detach prematurely. And if it separates prematurely, the lifeline of the baby is what is detaching from the mother. So you must go in and bring the baby out immediately. In fact, it's one of the conditions that give you hormonal signs, the bleeding we talk about. In which case, if you don't attend to the baby in 18-30 minutes in some cases, the baby may go. So there is always a reason. Just ask why. Then for those of us that have done cesarean section before, or any form of surgery, myomectomy, wedge resection, any surgery on the womb, be clear. Ask your doctor why you should have a cesarean section. Okay? Because most times it's better to have a repeat cesarean section. Depending on the reason you have the surgeries, there are so many factors that come with it. It's funny sometimes when some women, they are young age, they will come and say, no, I want cesarean section. Yes, we've had cases like that. They come, request, maternal request for cesarean section. You had the first one, want to request. The second one, you are not demanding that you want to have vaginal delivery. When in actual fact, the first has to be merited. You're not supposed to just come ask. For you to have asked for the first one, you should be ready to have others via cesarean section. Even if you're having 6, 7, 8. Well, I'm not recommending more than 2 or 3 for you. But I'm just suggesting once you request for the first one, be ready to request for the others. So some of you are falter. So once you falter, you come again, tell you strict, you're going for cesarean section. Say, oh, they like cesarean section. They like, no, it's what your body asks for. You only a champion when you listen to your body and your body also listens to you. Note, for both vaginal delivery, birth, cesarean delivery, cesarean birth, there are pros and cons. The most important thing is engage with the expert and get clarity. The best route is always determined individually through discussion between the pregnant woman and our healthcare team, prioritizing the safety and health of the mother and the baby. Don't panic, be confident, stay safe, eat healthy, nurture your baby in utero, and listen to your body, listen to your doctor. Remember to always stay healthy and save lots of money. Till we meet again, I remain your humble host, Dr. Adesanya Adewale. Gotcha.